Thank you so much, Henrik, for introducing everyone to the whole concept of mental health first aid in academia. And as you have already mentioned, I chose to establish such a program before there was a Mental Health First Aider Institute in Germany. So today I'm going to talk to you about the way how you can do it if in your country, for example, this is not an option. So I think it can be helpful for certain people here. So just briefly about myself, I did my MD in Moscow, and then I worked and did the experimental part in Pittsburgh, US. And then, as Brian already mentioned, I did the PhD in Germany, and then did a postdoc in Germany. Then I have lived for around a year in Lausanne, working for a tech company, and now I'm back to Germany. And so from 2019, I am I'm a co-founder of Dragonfly Mental Health, and we are working on aspects of academic mental health. Today, I'm going to talk about not the experience I had within Dragonfly, but rather my experience within the times when I was postdoc in Dresden. So during my PhD times in Berlin, I have, as Henrik himself as well, also experienced some mental health issues and disease, and there was no centralized support for students when it came to mental health. And also there was absolutely no mental health literacy education for academics. And there was no assisted or like easy path to healthcare professionals, especially for non-German speakers. So of course, all these issues delayed the time for me to reach out to a healthcare professional. And I figured out later it was the same for every other person whom I talked to about it later on. So in 2017, when I joined Max Planck in Dresden, and I became already a postdoc. So as many of you may be aware, postdoc folks typically have more leverage when it comes to organizing some sort of bottom-up grassroots initiatives. So I have noticed that, again, there was no centralized support for students when it came to mental health in my institute. And there was no mental health literacy education, no assisted paths to healthcare professionals. And the solution I figured out was to establish mental health first aider system. And so how I initially pictured it was that we would get a bunch of volunteers, and they would have a minimal training from healthcare MDs folks, sort of. Now I know something similar to a mental health first aider, but then I didn't know the name, but so I thought, okay, we would need some couple of days of training to be able to do the sorting properly. And then these volunteers would communicate with people in crisis and redirect them to healthcare professionals. Then they would also probably create and maintain the intranet webpage with the regarding info, and create and maintain the list of therapists of various languages, because waiting times when you come from the outside and you don't have the context of people in Germany, for example, is at least 3 months. So we wanted to bypass this problem by creating the list of our therapists and suggesting and redirecting them right away. So people would organize and host talks on mental health literacy and other talks as well, and would create and maintain the peer network and know that these things existed. We have there was no mental health first institute in Germany. So I reached out to a very supportive director in my MPI. His name is Ivan Baines, and he was always very, very supportive of all the initiatives of such kind. And then he said, okay, I see the problem. Let me figure out whom we could contact. And then he contacted Dr. Ilona Kroy. She's the head of burnout clinic in Uniclinic Dresden. And then Ilona Kroy and her team They adapted, we believe, already existing mental health first aider resources, and they created the subsequent training for mental health first aiders and mental health literacy lectures, focusing on academic settings. Unfortunately, it took a very long time because of all the organizational things and creating the program and so on and so forth. Then from the first time I talked to Ivan till the actual training we had was approximately 8 months. And of course, it did take a lot of money. So without the support of Ivan, it would be nearly impossible, because we eventually, the institute paid around 15K. And comparing to the mental health first aider course, which Hendrik mentioned, which is around 200 euro per person, the Hendrik's option is much cheaper. Free of charge alternative for us was, and for you still is the Johns Hopkins University course on Coursera, which is psychological first aid. I'll put a link when I'm done with my talk in the chat. So this is something one can do as a volunteer. It's also a short course. On disasters, fires, or earthquakes. However, there are some similarities, and of course, some helpful. This is an interpreters, and I don't have a. Okay, so we've got our mental health first aiders of various languages, various career steps, and various education. We have organized and participated in mental health awareness weeks starting from 2019 and going on. We have created a peer network dedicated to mental health. However, it's a whole different story. And we have created and maintained a local database of therapists with recommendations. We have started the mental health conversation at the institutional level and trying to destigmatize the mental health topic. This is something which Hendrik also mentioned in his talk. How it looks like when you go to the internet. So here is the internet webpage, and when you go to my institute, you see the good research practice. This is the only space we negotiated in the internet. And there is a so-called mental health initiative. So when you go to the mental health initiative, you see the description, the goal, the contact person, and on the left, you see the parts of this initiative. So for example, right when you go on the first page, you get exact links on where to get the professional help right away. And we believe this was the most important thing which we have achieved, is that someone who would need to get help, get the links at the first click. And then there are other initiatives which we created within the peer network. So it's mental health first aiders. I'll show you how it looks like. Also pre-doc, postdoc tandem, and finding an experienced postdoc when it comes to scientific questions, events, lectures, and seminars, schedule, some useful information, some reports on meetings, and other things. And so this is very similar to what Hendrik showed, how the mental health first aiders page looks like. So we've got the person. They also said something about themselves, which career step they're at, and which languages they speak, because we imagined that we wanted to cover many languages, because some people may be much more comfortable speaking with their own language, native language. So this is how our mental health first aider webpage looks like in intranet. Pros of this method was that we eventually got mental health first aider system working, and we also got to design it the way we wanted. Since it was locally built and locally promoted, we got an easy access to local help resources, such, for example, as our connection to Dr. Ilona Croy and the Burnout Clinic in Dresden. And this is the way I would suggest, this is the possible way to recreate similar programs in places where the mental health first aiders institutes are still not at place. Cons, first of all, there was a long period of development, now overcomable because we now know how to simplify it, and there's some already things at hand. And if you have better connections to MDs and faster connections to MDs at your local places, then it can be probably faster. Also, high activation energy was required because we needed to go to the director needed to approve it, we needed to convince them, and all these things are not like 10 minutes thing, you know. For us, it was pretty costly now, which is overcomable also with free of charge courses, for example. Again, it was only possible because we got the faculty support. And also, as a con, it's semi-sustainable. So for last year, for example, I'm not at MPI anymore. And while we all got this system at hand established, at a certain point, we'll need to reactivate it. Hopefully, when someone excited and energetic will join, and someone who would be interested in mental health first aid. With this, I'd like to close my part. I'll be happy to answer the questions. If you have any questions, you can always email me at ola@dragonflymentalhealth.org. You can check our YouTube videos and Twitter. We also talk there about peer network, system organization, all these kind of things which you may find interesting. Thank you so much.